Hello, my name is Mark Forbes, and today I'll be talking about increasing the proportion of rural, underrepresented minorities in health professions. There are several crucial issues at play regarding URM representation in healthcare. The healthcare industry is woefully behind being representative of the U.S. population. 13% of physicians are underrepresented minorities, despite this population making up 35% of the general population. This chart shows the percentage of underrepresented minorities in the general U.S. population versus that in healthcare professions. You can see that there's a vast difference between the representation overall and how it varies throughout the different aspects of our healthcare system. Demographic shifts are presenting a need for urgency on this issue. Countries rapidly becoming more diverse. The Census Bureau predicts that the white population will drop from 62% to less than 44% by 2060. Based on these numbers, it will be difficult for the physician workforce to mirror the U.S. population. If the healthcare industry is going to achieve equity in medicine, drastic changes will need to be made. This chart shows how drastic those changes would need to be made with medical school demographics. By 2060, we would need to see a 340% increase for Hispanic and Latino populations, 121% increase for Black or African American populations, and as high as 364% increase for American Indian and Alaska Native populations. One may ask, why is this important? Health disparity. Both rural and urban underrepresented minority patients have markedly worse health outcomes than white patients, and they are more likely to die of preventable diseases. Also, representation matters. Mounting evidence suggests that when physicians and patients share the same race or ethnicity, the quality of care is improved. Some examples and considerations to this point. When doctors and patients share the same race or ethnicity, each of the following are improved: time spent together, medication adherence, shared decision-making, wait times for treatment, cholesterol screening, patient understanding of cancer risk, and patient perceptions of treatment decisions. A Stanford University study paired Black men in Oakland, California, with either Black or non-Black doctors. The men seen by Black physicians were more likely to engage with them and even consent to preventative services like cardiovascular screenings and immunizations. The study also found that Black doctors were more inclined to write detailed notes about their Black patients. This is literally a life or death issue. There are several additional benefits of a more diverse healthcare landscape. Underrepresented minority physicians are more likely to do all the following: care for patients of their own race or ethnic group, practice in areas that are underserved or have healthcare shortages, care for poor patients, patients with Medicare and no health insurance, care for sicker patients, and choose primary care as their specialization. Race and language concordance improves patient trust, satisfaction, comprehension, intention to adhere, chronic disease management, and the likelihood of follow-up. Also, diversity improves learning for all. White medical school students within the highest quintile for student body, racial, and ethnic diversity are more likely to rate themselves as highly prepared to care for minority populations. This association was strongest in schools in which students perceive the positive climate for interracial interaction and are more likely to have strong attitudes endorsing equitable access to care. But why are fewer rural, underrepresented minority students getting accepted into postgraduate health programs? In a 2018 study conducted by the University of California at San Francisco titled Breaking Barriers for Underrepresented Minorities in the Health Professions, several barriers were cited. Three of the major barriers include lack of academic preparation, limited exposure to health careers, and poor advising. With lack of academic preparation, rural underrepresented minority students often receive lower grades in gateway courses, likely because they come from schools with fewer resources to recruit and retrain strong teachers. Underrepresented minority students may not know about the use of academic support services that are available to them. And underrepresented minority students who first started at community college face two significant barriers: lack of articulation agreements between schools and a lack of bridging programs. Many rural, underrepresented minority students come from economically disadvantaged backgrounds and may not have health professionals in their families or social networks. Underrepresented minority students may also have difficulty completing internships unless they are paid because they need to earn income to pay for their education. Lack of exposure to health careers outside of the classroom may make underrepresented minority students more dependent on advisors at their universities. Some advisors may discourage students who receive poor grades in introductory science courses from pursuing admission to medical or dental school instead of helping them improve their performance. Now that we have identified the issue, we must address what role can a pre-health coordinator play in all of this. I will first propose 4 solutions to increase the pipeline of underrepresented minority students into UNCW. First, formal institutional partnerships. Connect with and travel to high schools with high underrepresented minority populations to offer pre-health informational programming. Connect with advising departments at community colleges to offer pre-health informational programming to students. Also, bridge summer enrichment and fellowship programs. Support, assist, and reinvigorate the development of CHHS's past and present work in this area, including iHeal, Health Equity Fellowship, Summer Ventures, STEAM Camp, and also consider the development of a mini medical school for high school students. We develop programming for high school students interested in becoming healthcare professionals. One program designed currently at the University of Alabama is called Rural Health Scholars. Students attend tutorials and seminars, shadow healthcare professionals, and take field trips to rural medical facilities. We could also develop programming for high school students interested in medical research. One program currently being offered at the University of Alabama at Birmingham is called Pre-College Research Internship for Students from Minority Backgrounds, or PRISM. In this program, high school students are interested in careers in healthcare with hands-on research experiences under the mentorship of surgeons and their peers. I also propose 4 academic advising solutions that the pre-health coordinator could undertake. 1, direct students to seek tutoring and remediation. Consistently direct all pre-health students to seek tutoring services and attend SI sessions for their STEM courses. You should encourage a growth mindset in students when they struggle with any gateway course. Develop and provide resources to assist students with skill development in these areas. 2, reduce course loads in the freshman and sophomore years. Institutions with lower acceptance rates have students that tend to take biology, chemistry, and mathematics in their freshman year. We should work with the university college to appropriately advise students not to overwhelm themselves in the gateway STEM courses in their first 2 years to prevent them from becoming discouraged and leaving that path. Direct students to seek clinical and research experiences. Many students are not aware of the importance of completing clinical, public health, or research internships when they want to apply to programs. Even if underrepresented minority students are aware, they may not know how to find internships. Lastly, increase student engagement. Encourage students to join and or create pre-health organizations on campus. These organizations are listed here, already exist at UNCW, and the list could grow. Lastly, I propose 4 advisor development solutions that will help the pre-health coordinator become better at their job. 1, implicit bias and implicit associations test training. Implicit bias training can help all academic professionals identify their biases and limit their reliance on them. This type of programming can be developed and lead to create larger conversations within the college. Develop relationships with offices of student support throughout campus. Gain a thorough understanding of all student support services throughout campus, and develop professional relationships with each office to streamline handoffs and personalize connections for students. Develop relationships with admissions officers at different grad programs. Admissions officers consider the programs at some institutions to be stronger based on their experience with graduates and advisors of those institutions, not necessarily from the students' qualifications alone. Lastly, clarify the role of the pre-health coordinator. The pre-health coordinator should not be a gatekeeper, they should be an advocate. They should encourage students to persist through academic struggles, help students to improve their academic performance instead of discouraging them, from continuing to pursue their healthcare path. As you evaluate my candidacy for this position, please consider how my skills, knowledge, and abilities will help me to implement the solutions that I proposed. With regards to the pipeline solutions, I've worked for 13 years as a high school teacher and possess a strong understanding of the developmental needs of that population. I have developed and administered district transition and peer mentoring programs supporting first-year students. And I've spent 4 summers advising and instructing in an Upward Bound Bridge program that served low-income and underrepresented minority students. For my academic advising solutions, I've instructed community college students for 11 years. I also have instructed Uni 101 courses for 6 years in standard, special topic, Pulse Learning Community, and Uni 101 Remix courses. I have primarily advised pre-health students throughout my advising career and feel very comfortable stepping into the role of pre-health coordinator. Lastly, for my advisor development solutions, I'm passionate about diversity and inclusion issues and have instructed social science coursework with that focus throughout my career. I've developed relationships throughout the campus as AAC chair and was heavily involved with the community outreach program as a secondary school teacher. Thank you for your time and have a great day.